Good morning. Thank you for joining us for our coffee conversation today. We have one of our beloved volunteers, Carla Youngblood, with us again today, and she is going to touch on mental health and breast cancer. We're so excited. This is such a needed topic, and who better to talk about it than Carla? So, Carla, tell us. Well, first, welcome back, but also tell us about all of the different things that you're working on right now. What's new? Catch us up.
Thank you. Thank you for having me. Good morning to everybody. I'm glad you took the opportunity to join us for this conversation. It's good to be with you all today. And of course, we're still virtual. But in the process, I've been doing several different things. And one of the most fun things that I've done since the last time I saw the whole group was you all's event, Pink Heart. That was Hot Pink. Hot Pink, Janet. Did I say it correctly? It was an event where they had designers to come out and design dresses, outfits, whatever fit to you. And so I was one of the models there. So that was one of the most fun things I've done since I've gathered with you all. Another thing I did was an event where it called Raising Our Voices. It was with UAB Art Center, and it's in their Arts and Medicines program. And it tied into with a group called Stuart Pilsner's Dance and Theater Group. And it was a bunch of actual survivors, people who had just had a family member or a friend that had been diagnosed with cancer. And they brought us together and they created a production that we presented. And it was singing, dancing, acting, and that was incredible. So I've just had fun just kind of being able to connect with the community a little bit. So that's what I've pretty much been doing at this point.
Yes, and thank you so much for being one of the models in our fashion show. I had the opportunity to watch it virtually, and you were killing it. You killed it. So you did. So if anybody wants to go on our website or YouTube and check it out, Carla, she did that thing. Okay. So without further ado, we want to talk about financial health and breast cancer. So always a touchy topic. Nobody likes to talk about money, and it's such an important topic, and it's a healthy discussion. So, often people don't want to talk about their finances. So, what are some tips or some advice that you might give to someone who might be a little bit nervous, like leading into this kind of conversation when it comes to their finances, when talking to somebody, like whether it's a medical team or a financial advisor, family member? What are some things you suggest?
One of the things I suggest is, one, we've got to start getting more comfortable with our friends and really being real. I found out in growing up in my era, we were taught money is private. You don't talk about money. And in today's society, I realized that, they told us what they knew. But I realized, in my opinion, that was in error, because not only do you share, and I don't mean all the deep details of every nuances of your finances, but if you have conversations about money, you could learn things from your friends, because some of the things that you may be dealing with, whether it's something good or something bad, you can share that with your friends and you all can help one another. It may be something positive as far as a way to save or a way to invest, or somebody may be in a crisis and need some assistance, and somebody having that conversation can kind of guide you to it. So I think what we've got to do is just kind of be a little bit more vulnerable and be a little bit more honest and have open conversation with our friends. And definitely, I even find some people in their homes with their mates. They really don't want to share the nitty gritty. You got some husband and wives that play the role as, you bring your half to the table, whatever you're going to pay. He brings his half or whatever he needs to pay, and the bills are paid. And the other mate may be drowning in debt, but the other one doesn't even know it because they're not having those conversations. So we've just got to be able to put that on the table and share it with your intimate friends. Ladies, we quick, girl, let me tell you about this date I had. We will share that information in a heartbeat. But we won't tell our friend I paid all my bills this week and I only have $30 left and I got to feel that well to fill up my tank or go to the grocery store. We won't have those honest conversations, and we've got to figure out how to get to the real and just be vulnerable a little bit and share that information.
Yes, and I love that you pointed that out with a quick to talk about the good, but that sensitive stuff, no matter how bad we need to lie, I'm not talking about it because it makes you feel uncomfortable, because
Right. It makes me feel
you have this
uncomfortable.
stigma. Mhm.
Exactly. And not only does it make you feel uncomfortable, people feel like they're being looked down upon. And you know what? You and the man next door, y'all may be in the same shoe. Or they may be in a better position and able to bless you. But they so busy thinking you got it going on till they don't know they need to bless you. So, you
Yes.
just never know the situations if you just be honest and put it out there.
Yes, yes. Pride can hinder you, and a lot of it is just like when you're taught that though. Like I grew up like that. Like you don't talk about your money. Nobody knows how much you make. Nobody
Right.
knows this and nobody knows that. But you never know who has a hand that can reach out and help you or give you good advice. But that privacy that we hold so sacred around money, it can be difficult to like change your frame of thinking and say, okay, like I'm gonna have this discussion because it'd be helpful for me. They're not just trying to know my business, they
Right.
could be a resource to me. So in knowing that, of course, like the main thing that really strips a person's finances of are unexpected life events, right? Like your
Yes.
tire went out, or your power bill is a little bit higher this month, or something just happened around the house and you didn't have the money to fix it. So in unexpected life events, in particular to breast cancer, nobody ever expects to get that. Nobody ever goes out and says, I'm getting breast cancer today, or
Yes.
anything like that. Nobody does that. It's an unexpected life event, just like anything else in life. So, people might not always realize how expensive having a breast cancer diagnosis can be. Just from insurance, co-pays, commute, living rurally and you have to travel to, a hospital closer to the city. All of those things add up to like a fiscal burden. So what are some ways that someone could adjust to that fiscally? What are some things that you would recommend that they kind of start to think on, or resources that they might need to look into?
Okay, look, when you say unexpected, y'all give me a second to plug up. The last thing I want to do is unexpectedly die on you all. So give me 1 second. All right, we want to unexpectedly kill on you. But when that happens, first of all, because you're thinking, one, you don't know. So first of all, unfortunately, when you're diagnosed with a situation, the first thing we're thinking is our health as it should be. That should be the first thing that we think about is our health. But even in doing that, try to find, that's why I really like about Forge too. You always have somebody to talk to and help balance you out, to help you think through some of those questions and some of the things to ask the doctors. That's one of the things you can ask the doctors. Go ahead up front and find out, based on your diagnosis, the things that they're required, that they're suggesting that you do. Find out the cost of those things. Contact your insurance and find out what those co-pays are going to look like, what those deductions are going to look like. And then at that point, now you know what you're facing up front, not only with my health, but now I know physically what I'm looking at with my dollars. Now at this point, we know if it's something that's going to be above our heads and it's going to have us drowning, we can reach out then to different social services in different organizations that may be able to offer some kind of assistance. Like Forge is one. They may not do it all physically for you, but they can direct you to some places. And there are several organizations in town. But one of the first things you need to do is check at all the hospitals. They all have that advocate there at the hospital. That patient care advocate, reach out to them because they are the first direct contact to resources. It may not be able to pay your light bill, pay your copay, but they can pay your light bill. And so that could be an offset for you. So the first thing you want to do is find out exactly what your cost you're looking at, understand where you are financially. And that way, when you go to somebody, because even as an individual, and when I decided I need to reach out to somebody for some form of assistance or something, I didn't just want to say, I need help. It's always good when you can say, I need help with X. When you can say something specific, then they can know whether to direct you or where to guide you or know how to really assist you. But when I just say I need help, they're not sure where to go and what you really need. And they don't think you've done an assessment yourself. So the first you have to do is assess your situation. know your numbers, and then you can really ask for what you need and not just that blanket ask, because people don't know how to respond to a blanket ask.
Thank you so much, and I agree. Like being specific with what you need, because you could say I need clothes, but they don't know what kind of clothes. Like what season is it? Like are you hot? Are you cold? What size do you wear?
Exactly.
It's the same type of form. Like if you need something specifically, it's okay to be specific about that thing that you need, because you can need help, but that you want people to know how to help you so you can get whatever it is that you may need. So I thank you for pointing that out too. And speaking a little bit to your journey, just wanted to kind of dive into your thoughts on this. So once you completed your treatment or going through treatment, do you think that there are any, or did you even experience any fears related to the cost after your cancer care? Just like continuing on, like through this diagnosis, after you complete your treatment and things like that. Are those some things that people can typically, experience? Like, anything around that?
I must say I was blessed through my situation. I had very good insurance, and so I had minimal deductibles to meet, but I did have those consistent copays. And so in knowing I had those copays coming, I had to go back and adjust my personal budget. I had to look at exactly what I had coming in, know exactly what I had coming out, and I had to say, okay, I've got to make some adjustments here, because I know every time I go, I've got to make a $35 copay. And when you're going to chemotherapy every week, that can add up. And that could be more than that's something you're not looking forward to doing every time. But when it adds up, because now you're looking, that's $140 right there. Not to take into consideration the medicine. So you have those different things that you're dealing with. And so you have to look at your budget and try to make an adjustment. And also you can talk to your doctors as far as their staff people to say, okay, what am I looking at? What's going to be my complete cost with this? And at that time, when you have those complete costs that are in place, then you can make arrangements. That's one thing. Another thing with us, we just feel like I got to figure out how to do it. Talk to people. People are willing to work with you. They're willing to help. And if they really can't do anything themselves, they can direct you. So always count your costs and try to find out up front what you're dealing with. And that was my biggest thing with those copays for the chemotherapy. It's like, man, who wants to go get chemotherapy? But then I got to go write this check to even get started. So every week I'm looking forward to going to write a check, then getting chemo, write a check, chemo. It just was, it was more than I could fathom, but I had to adjust my budget and drop off some things that I just didn't have to have in my life every day for a while in order to meet those copayments. And, some people think those little co-payments, they're small, but they add up over time. Because one, when you're dealing with it, the doctor may say you're going to do it 10 weeks. It may end up being 20 weeks. It may end up being 30 weeks. So unfortunately, we have to prepare for the worst and look forward to the good. And so that was what I did.
Yeah, and also it might be helpful for some folks to, identify somebody who can help them with that, right? Like if we know, hey, like I'm having some issues kind of keeping track of dates and costs, because it's just so much going on at one time. It might be helpful for somebody to assign a close family member or somebody in their care team to help them keep track of those things, so that they can make sure, that they're on top of it and it doesn't just hit them like, hey, ma'am, we're on appointment number, whatever, and you ain't paid this yet, so, it'll help.
Exactly, because you're so,
exactly,
you're so busy. Of course, the first thing, and it only should be, is you're focused on healing your body. But when you're focused on healing your body, but yet I'm worried about these dollar bills over here, that adds to the stress in my healing process, because now I'm so be worried about a dollar till I can't focus on my body. So another thing, we've got to be honest and put it out there a lot of time. Hey, I'm dealing with this, and we feel so alone, and you're really not. If you put it out there, you'll be amazed at the people that will reach out to do things for you. Because let me tell you a quick story. When I had a group of girlfriends, still have them, but I got a group of girlfriends. It was 9 of us all together. And we would just hang out and do fun stuff. That's just what we did. And when I told them I was diagnosed with cancer and I was going to have to do chemotherapy first, Before I had my surgery, they had a gathering where they bought all kind of food to barbecue and grill and everything, and they gave it away to people for donations for me. They couldn't sell it, so they gave the food away and asked people for donations because their goal was to try to help me not be in such a strain because they knew I wouldn't be able to do a lot of work. I'd have to take some time off. So you just be amazed at what people will really do for you if you just reach out and just be honest and tell them, because a lot of times what they say, a closed mouth doesn't get fed. So we have to always speak up.
Yeah. Thank you for sharing it. And then that's such an awesome support system too. You know, it takes a village for everybody. You know, nobody does
Yes.
this life alone. So, what are some recommendations? So, you know, just touching on, you know, having that support system and things like that. What are some things that you would recommend to someone who is experiencing some financial barriers and kind of just having a hard time understanding what's going on? What are some questions that you might think would be great for them to ask their provider about the cost of care? Oftentimes you want to go to a doctor, but you don't want to talk about the copays. You don't want to talk about, I need this care, but I'm having some financial barriers. What are some good questions or some great tips for individuals who are in that setting?
One always ask, like I said, is there a way to set, let them go ahead and total it all up, and then you set up an extended payment plan? Because, okay, fine, you may need to pay $50 every time you go, but if they go ahead and group that whole payment together, and they may maybe say you can pay $10 every time, it's going to extend your time out needing to pay it, but that's going to give you something manageable that you can do. So that's one thing you can look at. And also, we've got several different organizations in Birmingham that you can reach out to. But also, when you're talking to your provider, ask them, they may say, you're going to take these 3 drugs at home. Those 3 drugs may be very expensive. Ask them if there's something else, another brand that they could recommend that's going to do the same thing, but it has a cheaper cost to it. So that's something we can always look at, because a lot of times they can always recommend something else that's cheaper. Of course, their doctors, their focus is just on medicine. And when I say medicine, meaning what's good for your body, but there's always different layers of the same drug that is less expensive that you can have. So always ask that question as well to make sure that that's something you've had at least a chance to talk about, to make sure that that's an opportunity to make a change there.
You. So I think that's such a good tip too, to think about like what adjustments can be made. So it's not even always just about, setting up a payment plan or anything like that. Sometimes it's like, hey, like, is there a cheaper prescription? Or, is there another alternative that would be more cost effective for me in my situation?
Yes.
But it does take that level of transparency and saying, hey, like that is pretty expensive. Is there anything, more affordable for me in my situation at the time? Is there something that's completely covered by my insurance?
Exactly.
Those are some great, healthy conversations that are really healthy and beneficial for finances and stress level, because now you're not worried about, oh my gosh, like, I'm going to pick up this medicine, how much is it going to cost? And if it's just going to be too much, like even having that person to kind of talk through with the insurance company with you.
Yes.
Like oftentimes you call your insurance company and they'll be like, hey, it'll be this amount of money for this copay and thing. So having that support system and that transparent conversation with your doctor, like you said, asking for those specific things can be very helpful to a person's situation.
Yes.
So you volunteer with us, you do like 1,000,001 things. You are a woman of many hats. So we know that you've offered to provide financial services to our clients who might be experiencing some financial difficulties as they navigate through their diagnosis. What are some things that you will work on with them in financial counseling? What are some things that they can kind of expect to learn and know more of and things of that?
The first thing they would get and the first thing they would receive is, hey, we've got to be honest. We've got to have some open, honest conversation. We've got to put it all on the table, because you'd be amazed at how many people, they know how much they make, but they have no idea what their monthly expenses equal to. They have no idea. If somebody said, hey, what do you have to pay every month? You know, regardless, most people don't know that number because they're just paying bills as they come. They're just making their way. But we need to know our numbers. So the first thing I would do is have them to truly identify what's coming in and identify what's going out. And then not only the base things that have to go out, now I would get them to track their spending. Let's just see what we're doing. We love Starbucks, but we can't go to Starbucks 3 times a day if we're trying to track our spending and we're trying to accommodate for something. We got to make some coffee at home and just buy some creamer, that good creamer, and you'll be amazed that'll go a long way in savings. So really the main thing I would have them to do is to pull back and let's look at what you have coming in. We're going to create a budget, but in the meantime, and that's one thing, people set a budget because when you set a budget, it does 2 things. One, it puts you in control, and everybody wants to be in control, but they just don't want to deal with that money thing. Just as long as I can get the bills paid, I'm happy. No. Let's take control of our finances. And once you take control, then you can set goals with it. Not only are we just trying to survive through any type crisis that may arise, that we may be dealing with, but we want to be prepared. When COVID hit, nobody knew what it was. Nobody knew how to prepare for it. We didn't know what to think. And the first thing came to my mind was Susie Orman, where she's a big financial guru, where she always says, you need 3 to 6 months savings in place of your monthly expenses. Well, even if I'm trying to save 3 to 6 months, if I don't know what my monthly expenses are, I don't even know what my goal is. It's just like saying we're finna get ready to go to Canada and we don't use a map. We don't know how we're gonna get there. So if we're gonna set a financial goal, we've got to understand exactly what we need to get there. So when COVID hit, people lost their jobs, things got cut back. And so you got all kind of expenses that just went haywire for you. But now everybody's like, I can't afford to come up with 3 to 6 months savings. That's fine. Set a small goal to start where you are. You know what? In the next 3 months, I'm gonna figure out a way to save $500. And at that point, I give them creative tips to try to figure out what can I do to save some money. And one of the biggest things we can do is always go in those closets. We got dresses in there we hadn't worn in years. We got dresses in there with the tags on them, shoes that hadn't touched the ground. We can start with decluttering. We always have stuff around the home that we just had to have and we haven't done anything with. And if nothing else, that's one thing COVID has really taught me. Why do I have all this stuff in my closet? Now, of course, during COVID, like most of us now, we're at home. We're rarely going into the offices. So why am I still shopping? Why am I still buying new dresses when I'm not going anywhere? What's the point? Like now I tell people, I don't know when I'm gonna go and buy a new dress because right now it's been 2 years since I've really been anywhere. So now everything in my closet is considered brand new. I don't care how old it is, it's considered brand new because I hadn't worn it in 2 years. So why go shopping? But really, we have a lot of things around our home that we really don't utilize anymore. We could have people be happy to come. If you're in a crisis, they'll be happy to come and have a yard sale for you. But now we don't even have to put it in the yard. We got eBay, you name it, we got all kind of sites where you can sell stuff online. You don't even have to leave your home. So there are a lot of ways that I would give them tips to look at what they have coming in and figuring out, okay, if you don't have enough coming in based on what's going out, we got to figure out how to cut our expenses. And once we've cut our expenses as far as we can cut them, then we'll look at it and say, you know what, let's see what we can sell. Let's see what we can do on the side. You know what? I like painting. You know what? I'm going to start painting puppies. And I'm going to start painting puppies, picture of somebody else's puppy, and sell them. Everybody loves their pet. I'm going to paint birds. And you'll be amazed at what you can do. We all have these hidden talents that we say we just do to relax and for fun. You'll be amazed at how you can turn that into something that can subsidize your budget if push come to shove. I like to bake cakes. Well, you know what, Diane, you always go in here for some cake. Let's see if you want to buy one from me this time. They'll be amazed at what people not only will do, but especially when it comes to food. items that people want, people pay for what, just like we do, we all do. We pay for those resources and things that we want. So, you have things around your house and things that you can do where you can create other sums of money to subsidize. So assisting somebody, the main thing I would do is we set a financial goal, create a budget, and then I would become the accountability partner. That's one of the things I want to talk about is accountability partners. Now, if you're married, you should automatically have an accountability partner. If you're married, you should automatically have an accountability partner.
Somebody got to do right.
Because even if he pays all the bills, you should be looking at the statements. You should be sitting down with him to understand it. We've seen too many movies where the husband dies and the lady's just standing there and she doesn't know what to do because he paid all the bills. I don't know where anything. I don't even know where the bank account. We should be aware. If she pays all the bills, he should be aware. So if you're married, you should have an accountability partner. If you're single, that girlfriend, that boyfriend. Well, when I say boyfriend, I don't mean that boyfriend. I mean that boyfriend is just a friend, but not a real boyfriend. You know what I'm saying? That should be your accountability partner, your sister. But we should get somebody that we can have that honest conversation with. And I can call my sister and I can say, hey, you told me last month you was going to save $200. Did you save those $200? When you've got that accountability partner there, and that's someone who I know is going to check on me to make sure I did whatever I said I was going to do financially, do it. And another thing, a lot of people just don't want to do, we'll go ahead and get that personal trainer to make sure we can wear that dress when it comes time for that reunion. But we won't get a trainer, a financial trainer, to help us put our money in order. Some people, they break out in hives when you talk to them about money. Mm-hmm. And it shouldn't be that way because unfortunately, we need it to live, we need it to survive, and that's how we make our way. So we have to have open conversations. So we need an accountability partner. When you got somebody who's going to hold you accountable, you're a little bit more apt to do whatever it is you said you were going to do, no matter how small or how big it is.
Thank you so much. And yes, accountability, like somebody's got to do right. Somebody's got to help you do right. And I love that you identified different people that can kind of help you. And again, going back to that healthy support system. Do you have any other final thoughts you'd like to leave everybody with today? Anything you have coming up or anything you're working on you want us to know about?
Let's go back. I'll go back to some finances first. Just talking about, because I talked about one, knowing what you have coming in and being able to track your resources. Another thing that I didn't mention, sometimes we end up in a financial crisis because we end up with a diagnosis such as cancer. Most people hate to say it, let alone they hate to do it. But it's okay to file bankruptcy. That's what it's there for. Sometimes nobody asks for cancer. Nobody asked for all this debt to come. I lost my job. I'm totally in over my head. It's okay to file bankruptcy because, that's only a reset. It's there for that purpose. It's not, some people say, no, my pride won't let me do it. You know what? My pride didn't ask for cancer. I didn't ask to lose my job. And now I got all this debt standing before me, and there's nothing I can do about it. It's okay to file bankruptcy. You can file bankruptcy and keep your home. And all it is a reset. And that's what it was put in place for. You got some people, of course, like any other thing, they try to misuse the system. But when you're in a crisis, consider that. That's what it's there for. It's okay to reset because when you think about it, once you're having to deal with all of that, you've got to reset your life anyway. So why not get a fresh start? That's the option. And most people don't want to do that, but you got all these late payments. Your credit's going to get a ding anyway. Why not get a fresh start, file bankruptcy, and start again? It's always the last resort, but when you got things coming on you that you didn't ask for, it's there for that reason. It's there for that reason. And the judges, that's what they're there for. They understand. And they would invite that because the goal is not to have people out here struggling when they've had to come into situations that they didn't ask for. And that's how that works out. So that's unfortunate, but that's the real deal. But me, myself, right now, I'm doing financial counseling with other people just on the side. I've started talking about it because after COVID, I realized they said less than, I want to get my numbers right, 76% of Americans have $500 in emergency savings if something was to happen and come up. In other words, I just blew a tire. Now I need 3. And most people can't afford $500 just as emergency savings. And we know our average expenses run more than $500. So I just want people to just be honest about what they have and really look at their numbers. And let's figure out a way to attack the debt. Let's get rid of stuff that you don't need. And you got people who don't even look at their bank statements. So little small charges, if it's coming in every month and you don't know it, in a year or two, you look up and that may be $300 gone from your account that you didn't know it. You know, you sign up for these different subscriptions, Netflix, Hulu, and you say, I'm gonna do that 30-day trial, and you forget to cancel. And now that's hitting your credit card statement every month, and you're just paying it because you're not looking at the statement. Oh, I know I wouldn't have spent $300, I spent $200. But those little $12, they're starting to add up. So I just want people to really look at what they have and what they have going out. That's always the first step. So I just want people to just pay attention to their finances like they pay attention to everything else.
Thank you so much, Carla. You are such a huge resource to us. So we're very grateful that you agreed to come again and talk to us about such a needed topic. And I'm sure like there's so much room. This conversation could go so many ways and get so, so detailed. So thank you so much for just giving us the information that you did give to us. And we know this is going to help multiple people and, as they kind of think of ways to kind of navigate through, their financial situations, not only just with breast cancer, but just in general with unexpected life events. So thank you for coming with us today, and we will see you again soon.
Thank you so much.